Hi, I'm Peter Rogers, MD. In this lecture, we're going to be talking about drinking water, how to choose your drinking water, how to filter it, things to be aware of. We're going to loosely go by the chapter about water in this book I wrote called A Tale of Two Toes and a Hot Tub. Okay, the chapter on water. All right, so the first thing I'll talk about is, drinking water. And then, the chapter begins talking about 20 years ago, if you see a diet soda on a table, you think, oh, gee, a fat lady was probably sitting there. Nowadays, if you see a big giant bottle of water, it's probably a fat lady sitting there. And the point being is, for some reason, people got this in their minds that if you want to lose weight, you walk around with a big bottle of water. I don't recommend that, okay? One of the things you got to be careful, if you drink too much water that's over-filtered, it might have a very low osmolality in it, and you could over-dilute your blood, so to speak, and potentially induce a hyponatremia. There's been stories about, especially women, because they'll have a tendency to drink more water in these long races, like a marathon race, every 500 yards, stopping at the rest station and drinking water, to become so over-dilute, so hyponatremic, that means lowering the sodium content in their blood, that they actually have seizures, and some have even died. Okay, you can look that up on the internet. Hyponatremia due to excessive drinking water during long-distance races. All right, so anyways, let's talk about things I think that'll be helpful to you. The first one is TDS. TDS means total dissolved solids. A TDS meter is just something like this. You put it in the water, push a little button. You can buy these things for about 10 bucks off the internet. You put it in the water and it'll tell you the number of particles per square centimeter, about a milliliter, right? And basically, TDS gives you an estimate of how purified the water is. And you can kind of guess how it was purified by knowing the TDS. The relevance being you want certain bad things removed from the water. And in addition, if you think about blood, now blood is not the same as water, but blood does have an osmolality to it. About 285 to 300 osmolality is typical for human blood. TDS is not exactly the same thing as blood osmolality because blood is a non-Newtonian fluid versus water is a Newtonian fluid. And what that means is water is the same whether it's stationary or in motion, moving slow, moving fast. Water is just water, but blood is not. If blood is stationary, it starts to aggregate. Blood is what is called a thixotropic fluid. But besides all that stuff, I can tell you, TDS conceptually is very similar to what you need to know in terms of choosing a drinking water. When you drink tap water, in the ballpark, depending on your local filtration, it's probably in the ballpark of a TDS of about 500. If you drink carbon filter water, it's going to be in the ballpark around 200. Check it for yourself. It'll be a little more, a little less, but it'll be in that ballpark. If you drink carbon filtered water, we just talked about that being 150 to 200, maybe 200-ish. Reverse osmosis filtered water in the ballpark of about 10 to 110. Distilled water is the most purified. That's like 0 to 2 TDS. All right, so I don't think it's safe to drink distilled water. It's too purified. I worry about it's so eager to have particles attracted to it that I worry about that making you hyponatremic. All right, reverse osmosis filtered water, which I actually think is good, removes a lot of bad stuff that you want removed, but you should try to eat first before you drink that water, because even that, especially if you get towards 10 rather than the upper limit around 110, 120, can be over purified in a sense. If you're drinking carbon filtered water around 200, that's probably fine. You don't even need to think twice to drink as much as you want. I think there's an overemphasis nowadays on drinking water. I can tell you, I wrestled in college. My coaches were the world champion, Dave and Mark Schultz at Stanford University. We didn't drink water during practice. We'd sweat off 5 or 10 pounds every practice. We'd drink water after practice. Nowadays, they didn't even sell bottled water when I was a young guy. After they started selling, things like these energy drinks and bottled water, all of a sudden it's, oh, you need 8 cups a day. Yeah, right. Where did that 8 cups come from, okay? You got an 80-pound woman, you got a 350-pound lineman, okay? 350-pound lineman after practice, he needs to drink a lot more water than that. The little 80-pound lady, she don't need to drink hardly anything compared to that. You can just take a look at your urine. If it's dilute, okay, then you're relatively well hydrated. If it's not, it's orange, you're probably not so well hydrated. Go by your thirst. That's what humans have gone by for millions of years. All right, so we talked about osmolality of the fluid. And by the way, in marathon races, guys didn't even drink water back in the 1950s and 60s and some of them in the early 70s. I'm talking about guys who won the Olympics, that won the marathon in the Olympics, okay? You don't need to drink that much water. The next thing is, what do you store your water in? I recommend store it in glass. These plastics tend to have BPA, that's bisphenol A, which is estrogenic, and even though, yeah, they don't even make them in bisphenol A necessarily anymore, they still quite often are using some type of BPA substitute, like BPS, for example, which still has the chemistry of an estrogen, meaning that it'll have like a benzene ring with hydroxyl group on it. That's called a phenol, which is still estrogenic. It binds the human estrogen receptor and can have estrogenic-like effects, meaning that it can increase the risk of breast cancer, prostate cancer, endometrial cancer, and also increase the risk of obesity, okay? So store it in glass. Glass is relatively inert. As far as choosing your filters, probably the cheapest, fastest way to filter your water is just get a carbon filter. You need to switch them out periodically, but they're pretty cheap, and they will remove organic compounds that tend to be estrogenic. For example, not uncommonly, there could be atrazine in the drinking water. That's a herbicide often sprayed on corn, sometimes sprayed on golf courses and other grass and whatnot. So that'll often get into the drinking water. Municipal water filtration, their main goal is to prevent infection. So they got chlorine in there to sanitize the water, prevent infections. They don't necessarily care that much if there's some organics in there. They don't try to remove all of that. So lots of women, by the way, are taking oral contraceptive pills, OCPs, birth control pills. Very often the chemical in there, the active chemical, is going to be something like ethinyl estradiol, EE2, okay? And she's going to avoid it in her urine. It's going to get into the drinking water. It's not necessarily going to be filtered out by municipal water filtration. So if you want to remove that, you need a carbon filter or a reverse osmosis filter. The problem with reverse osmosis filters is they're kind of expensive. Typical RO filter is going to cost you about $600 to install it. You got to get it checked about once every year or so, and that's going to probably be a $50 checkup or $100 checkup, depending on the complexity of your RO filter. But anyways, those are things that it's good to be aware of with regard to water. So what other estrogenics should you be aware of in the water? Those are the big ones, the birth control pills, the herbicides, but there's other estrogenics in there that you don't even know about. So it's just nice to remove them as best you can. And as far as hydration, I think the other thing was try to get some food particulate material in yourself, because otherwise if you induce hyponatremia, that can cause headaches and it could even make a person sick if it's really more extensive. So that's it for water. Hope it was helpful.